I do have two screens, and so just in case, if you see anything or if you have questions, please put them in the chat box, and I'll make sure I get to them at the end. I want to make sure I do see everyone's questions or feedback or anything like that. So just give me one moment.
And Alexis, are you okay if we record this for some folks that aren't here?
Oh, of course.
Wonderful. And you know what? You're gonna tell us all about Ascension and some of your roles. So all I'll say is look in both Handshake and on the Ascension career site, and you'll find a multitude of opportunities, some of which we're going to learn more about today. So I'll just make it short and simple and hand it back to you, Alexis.
Thank you so much. Making sure, can everyone see my screen?
Yes.
Perfect. Alrighty, well, I will get started. Well, thank you all for coming, and I'm looking forward to chatting with you about Ascension. My name is Alexis Guerra. I'm Ascension's National University Diversity and Inclusion Talent Attraction Specialist. However, you could just call me Alexis, and for right now, you can call me Ascension's National Talent University Specialist. Within this role, I research and connect with various organizations, colleges, and other resources to source and engage with potential talent with inclusive hiring practices. We're committed to offering a place of dignity and inclusion for all associates while providing opportunities for professional growth and career development along the way. So, within my role, expanding the connections between schools and the market, which is the facility and area that they're located in, and across the nation to share out healthcare opportunities for their students. We are a faith-based healthcare organization, one of the leading nonprofit and Catholic health systems in the United States, and we're dedicated to transformation through innovation, which is one of our values, creativity, which we describe as courageous innovation. While the Ascension Network expands across the United States, a common bond unites our caregivers at each facility: the desire to provide compassionate, personalized care for all, especially to those most in need. And I will say we do continue to have a stable, growing network. We see here that we have 11 states. Just this summer, we were acquired with Ascension, Illinois, making it 12 states. And so this needs to be updated already as we continue to grow. This is the foundation of our organization. It's how we show up as one Ascension. We're advocates for that compassionate and just society through our actions and words. So, service of the poor is one of our values, generosity of the spirit, especially for persons most in need, that reverence of respect and compassion for the dignity and diversity of life, integrity, inspiring trust through personal leadership, wisdom, and integrating excellence and stewardship, creativity, that courageous innovation I mentioned before, and dedication, affirming the hope and joy of our ministry. It's our mission, which is outlined on the slide, our values, and our essential behaviors, which helps us build up that living our promise. Our goal for new associates is that as part of the Ascension team, they'll benefit from the support of nationwide collaboration between our hospitals, medical practices, and healthcare innovators across the 12 states in which we're currently located in. We also have our Abide framework as a part of a sustainable and system-wide commitment to listen, prayer, learn, and act to help racism and systematic injustice be addressed. This framework is built upon the hallmarks of appreciation, belongingness, inclusivity, diversity, and equity. Abide is how we show up at Ascension to seek out our mission as a health ministry in a way that celebrates the inherent dignity of each and every person, our fellow associates, the patients, and the communities that we serve. This work is ongoing and requires participation from everyone in order to change for it to be lasting and transformative. We're committed to fostering a culture of inclusion across all areas of our ministry. Work is more than a place that we go to each day. It's going to be that environment that nurtures relationships, cultivates talent, and supports a positive culture for our associates. This shines through as we have been awarded for things such as Best Company Work-Life Balance, Forbes America's Best in State Employers, Best Company for Career Group, and many more. I do want to take this moment to hear from you all as professionals. So, if you do have anything, if you want to unmute your mic, I would really appreciate that because you are not only the true academic professional subject matter experts, but are the ones who are going to know kind of seeing the trends that are happening within our upcoming future workforces. And so, one thing I do want to ask and see, what type of recruitment efforts do you see most successful with your students, and what are some of the least?
Well, I'll jump in because recruitment is what Daisy and I work in. Our academic colleagues less so, indirectly, less directly probably. It's an interesting question because I'm in the beginning stages of putting together a best practices essentially meeting for recruiters. I'll have to make sure you're on the invite list, Alexis, if you'd like to attend. And we're going to have a few guest experts come in and share just a little bit of information, but we're also going to have folks that are there exchange some of their insights from their work. But I have, I guess, a few. It I almost forgot. This just occurred to me this morning, but I almost forgot that it's so close to me. It's like the nose on my face. But working, making that contact, that connection with the people at the university, I think is super helpful. And carving out time like you have today to come in and simply speak to us is simple but a big thing. I mean, not all recruiters will do that. So many of them will say, "Well, everything we have is posted in Handshake or on our website." And we're like, yeah, we kind of know that. But making the time to talk to us personally, to get to know us a little bit, we turn around then and we do things on a more personal basis for those employers that we're connected with. Um, and the folks that are here will do the same thing. They will leave and become brand ambassadors, so to speak, in terms of sharing what they've learned and making sure learners who are looking for some ideas about places that might be good employers in the future, they'll remember and they'll bring it up. So that's one simple thing. And another is just the personalized, as much as you can personalize outreach. We do that through our efforts in the Career Center. And when learners receive our personalized messages, they sometimes respond in a way that makes it sound like they think we're just talking to them individually, whereas I may have sent out a message to thousands of them. But if you can integrate their names and make sure that it applies to them in terms of their discipline and what they're looking for. So those are just a couple of things that occur to me off the top of my head.
I love that. Thank you. And I was
You're
writing
welcome.
notes down, so I had my serious notes taking face in there. So I appreciate that.
Sure thing.
Wonderful. So moving forward to some of our opportunities, we're looking at our nurses for right now. Our nurses account for over 1/3 of our total associate population. So more than 50,000 nurses strong across our national network. For students, we have various national and local events that we invite our students to. So local events are going to be for that specific Ascension facility at that specific location, and national events are where all of our city facilities, all of our markets, they're going to be at one virtual event for students from across the country to join in to be interviewed by their location of choice. They can join on a video or text based chat for the interview and can join in through their laptop or mobile device. We really try to make sure that it's in the hands of those students to interview and feel comfortable at whatever there may be. So we have some students coming in for lunch, some students interviewing in their car, whatever the case. We want to make sure that they're being able to say, hey, we know things happen. We know your life is continuing on, and sometimes you can't go to in person, but we still want to make sure that you know that there's opportunities there. We do have our residency program, which is created for our nurses and is designed to innovate, inspire, and empower them as they begin their career with us. Our program provides opportunities for our new graduates to attend a variety of learning activities outside of their clinical experience, such as self guided learning modules, interactive discussions, simulations, hands on skill practice, and then, of course, we also offer career coaching and specialty pathways for available for new grads. An example of the RN residency program would be either a rotating day or night shift within a 12-week program where there's an evidence based project at the end. The details and schedules of the residency will depend on that specific location and facility. And majority of our facilities do have those student internships and externships for a current student nurse to be able to go into the hospital and work and be able to get some more hands-on experience. But let's say they kind of want to start now and don't know what areas they want to get into. These are just some roles: patient care technicians, certified nurse assistants, medical assistants, patient transporters that we have seen within Ascension that current nursing students are currently in before they get into their residency and graduate. So just want to make sure they do understand and see that, hey, if they don't want to get into an internship or don't know much about it, they can also look at these roles within that area and do that again before they start graduating and getting into their actual nursing experience. Also, here, what I've done is created a few of our SNHU programs and try to marry some Ascension job titles that are currently available, either entry level or manager director level, just to get some insight for students. I know one of the things, especially in the healthcare world, there are so many opportunities, but sometimes it's hard to navigate which subspecialty or where do I start or what should be a goal at the end if I know I want to be a manager, but what type of things do I need to specialize in? And so I really wanted to pinpoint some things, at least in our current Ascension facilities throughout the nation. Please note that some of these roles may expand or may go to other areas, other states, but just some special job titles or specialties that they can start looking at now. So, for the community health education program that focuses on community health programs, I included a few job titles: health and wellness specialist, wellness center assistant, community outreach coordinator in Texas, community outreach manager in Illinois, just to give some ideas of what are they looking for now. Is this something that a current student can go to, like the wellness center assistant, like the specialist or coordinator? Or if they're graduating, what is something that they can look to in the future? That manager role. They're going to have, if they have a bachelor's, all they need is that 3 years. And if I need to look at and building relationships with community agencies and making sure I can put that on my resume for that manager role in 3 to 4 years, I want to make sure I have that on top of mind. The health science program, it would be a great way to move into those allied health roles, such as respiratory therapy, getting the license for a surgical technician or certification, and even maybe going to medical assistant during their time right now and moving forward to those allied health positions. Public health, I did point in something that I found interesting that we do have the clinical research associate. This is currently in Alabama, but kind of gives some insight where they do perform the daily project protocols depending on that specific project that this Alabama associate needs. And then I did find that interesting. Understanding the FDA rules and having phlebotomy experience is another little something extra that they could have or start thinking of now to say, oh, this is something that a healthcare industry position might need. Phlebotomy experience, maybe I can start getting that now or figuring out steps now just to have something underneath my belt. Healthcare information management, we have a whole job category dedicated to HIM. And so I did want to include some positions: coder, manager, and even assistant, to see some entry level, mid level, and manager roles and seeing what they have. And also, especially with our coders, looking to see what a hospital is requiring or asking for, one of the more following certifications, so they can start looking at those programs right now. Let's say from the American Academy of Professional Coders, being able to see what's the requirement and how can I get on it as soon as I graduate if that's the need, to make sure that I have everything I need in order to get my coder goal. For graduate programs, we do have various areas, so I wanted to make sure we included some of those. For family nurse practitioner, within Ascension, we have various areas within our Ascension umbrella because we are so big. So we have an area that focuses just on our Ascension facilities, our hospitals. We have an area that focuses on our physicians and practitioners. That's the Ascension Medical Group. We have an area that's just focused on senior care, Ascension Living, and even our business and operations side. So very vast different career pages and recruitment areas. I'd be more than happy to be a liaison for anyone interested. But for instance, for those practitioners, they would move forward with Ascension Medical Group. And as soon as they get their certifications, their degrees, everything like that, then they're going to be able to move forward with their career page, apply, interview, and move forward with them. Healthcare administration, they can go to many different subspecialties as well. I wanted to put a few in: program manager, population health experience, project analyst that specializes in surgical services, and then, like I mentioned, that Ascension Living director, which they would need a nursing home administrator credential. So, again, something with a healthcare administration individual who may be interested or thinking about being a nursing home administrator, they know they need to start looking up on how to get that credential. Healthcare quality and safety, I did want to bring in that RN quality coordinator. This one specializes in pediatrics in Texas. And then, of course, we do have some that do require some type of nursing experience. And then our nurse executive leadership, which can range for us from our clinical nurse leader, like I have here, or even some CNOs or directors or AVPs or anything like that. So one thing I wanted to bring up is I found interesting is that this has a certification by the Commission of Nurse Certification for a clinical nurse leader. So maybe that's something that if they don't have it already, then they can look into. Going back to our registered nurses, here's an example of what a potential SNHU graduate may experience during their time as an Ascension associate. So, starting point: the associate success, supporting associates to ensure the successful connection to Ascension benefits and programs in their first 90 days, using the voice of the associate to guide support and resources for their leaders and for them. Exposure. As a new grad, it is essential to put their knowledge from school into real life situations. Through their life with Ascension, associates are going to be actively encouraged to pursue that growth and development programming to improve their skills. This can be done by my career advising that we have for our internal employment, individualized support and advising for Ascension associates interested in development pathways. So anything from, hey, can we help spiffy up my resume? Because there is a supervisor role that I'm interested in. I want to make sure I clearly state that I am prepared and ready to go. Or, hey, I have this talk with my manager and I really want to make sure I start branding myself as that supervisor that's coming up in a year or so. And then we have our career coaches. Career coaches are going to be successful partners for licensed associates and those engaged in the career development programs to support their success. So, a little bit about that is one moment. The career coach model is categorized by 6 core tenets: assisting with exploration of the career pathways, facilitating the exploration of personal aspirations, and supporting leadership growth and development. The career coaching and support is best facilitated through the one-on-one conversations where the focus is that associate. Maybe they want to move from one specialty to another. Maybe they're really ready to go from that manager to director role. So while career coaches do encourage and support transparency, they also recognize that confidentiality is important. These coaches keep the conversations private unless given permission by the associate to share. They do this because they support them on their journey, recognizing that all journeys are going to be unique. Ascension is dedicated to ensuring our associates and their families are supported financially, mentally, physically, and emotionally. Ascension benefits include the individual and family focused benefits with a wide range of customizable and affordable options designed to protect your health, income, and well being in whatever stage they have. I do have a few points here, but also I do want to highlight we do have our military friendly employer and spouse employer benefits as well. So having specific policies related to our military and spouses, military engagement groups, and remote options, including leadership programs and the internal resources to proactively manage their physical, spiritual, and emotional well-being. Now, all they have to do is find the right opportunity. So, connecting with us to discover how they're going to be able to join Ascension, they're going to be joining a family that's united by that one common goal, providing compassionate, personalized care for all. For you all, as next steps, I would request and suggest maybe joining our School Context Connect portal. This is where you all, as academic professionals, will be able to have Ascension updates, job opportunities for students, event invitations with the registration forms to share out. I do have the link, and I'll put these two links in the chat box as well. And also at the end, I will send over a flyer to share out to your students. And so, for instance, for your nursing students or undergrad students, or whichever the case, learning about what's going on at the hospitals, including any local virtual hiring events or national hiring events that they want to get into, or just overall for a recruiter to be able to find their resume and contact them directly. They're going to be able to log in and answer just a few questions. I believe it takes no more than less than 2 minutes, and be able to put their information in that talent network. And thank you very much. I know I talked a lot. I want to make sure I have time for questions, but thank you very much, and I appreciate your time. Does anyone have any questions?
I have a quick foundational question. Without looking at the calendar invite, I forget, did I think I assume I asked you for more than 30 minutes, but I don't remember, Alexis. Can you?
Let's see. I have until 12:30. Yes.
Okay, wonderful. Thank you.
I'll also leave it open for questions, but I have to say that particular slide where you matched Ascension opportunities to SNHU majors was really exciting, and I very much appreciate that.
Thank you. Thank you very much. I was a little worried about that. I'm like, what if they say that doesn't qualify? But I appreciate that. Thank you.
No, I'm
Yeah.
going to second that. That's going above and beyond. And Alexis and I spoke. I think it was August 17th. Not because I have a great memory, because I looked it up this morning and looked at notes and email exchanges. And you asked for information, and I gave you all our programs. And to take the time to do that was really thoughtful. And thank you so much. We appreciate that. So while others are gathering their thoughts and coming up with a question that might be occurring to them, I'll put one out. I was impressed. It seems as though you have a very structured and formal career development program for your nursing employees, Alexis. That's what you showed us on a couple of those slides, I think, right?
Yes. And so one of our main things is we really, even though my role is getting the news out, right, and seeing and sharing these opportunities externally, but we knew in the very beginning that nothing will be done if we don't have that internal foundation. And so, especially with our nurses, and just with the past few years, even, and just their whole career, and now we're finally getting shone a light saying, yes, they go through this all the time. Being able to say that, what can we do that would help not only them stay in their line of work, but also know that we do care about their career development. And so we have internal resources that they can go through, either videos or certifications, things like that. But having the my career is what we call it, or career coaches, and being able to say, hey, if you want to have um, a confidential talk about maybe moving to a new specialty and you don't know how to tell your boss, then we can talk about that. And it's a lot more of, my career is focused on yourself and how to give you that confidence and give you the resources to shape you. And so, like I mentioned, a lot of times it's just on how to use your resume and edit it as a current nurse, or, and then career coaches is really where we're going to be able to shape you and say, hey, this is what you want to do. Let's do our best to give you the resources and figure out what you need in order to lift you up so you can get that goal. Pamela, I do see you have your hand up.
Oh, yeah, quick question. For
Uh-huh.
your community and public health positions, do you require the CHES or MCHES certifications?
I love that question. And what I can do is do a double check. And you said community health. And then what are the certifications again?
It's the certification. I can put it in the
Oh, chat.
chat for you.
Thank you. And so what I can do is do a double check. What I did here, since we have various states, I checked to see what is an entry level job and what are some higher, more managers. So we can do a double check on those to see. Currently what I'm looking at right now, even with the manager role, it's more for community outreach. And so they just require, that bachelor's, 3 years of experience and being able to showcase that they build relationships with agencies in the community. But I can always do a double check and dive in a little bit more and email Mark and let you know.
Great. Thank you very much.
Of course.
I was
Oh.
going to say, and I probably should have at the very beginning, that Alexis works primarily and maybe even exclusively with the nursing candidates and the recruitment, but she was very gracious to be willing to come and try to speak to the broad array of career paths and positions at the university. So there's a lot of different specialties that are going to be difficult to have all those details on today, but she's, as you can see, very detailed and very good. So I'm sure she'd be happy to follow up with anything she doesn't know off the top of her head or needs to dig in a little bit more for info. So thank you again, Alexis, for being willing to do that.
Absolutely. And I know Mark and I talked about this before, but so for instance, practitioners and things of that sort, that is with Ascension Medical Group, or even that director for Ascension Living, that is with our Ascension Living Senior Care. And so it's interesting when we have to kind of say, okay, so we are Ascension, but we have this right here, we have this right here, because we are so big and we really try to stay as organized as possible with that work. But I would always be happy to be that liaison to say, hey, this individual had a question. I want to make sure this is the right information. What are your process's next steps? And so just want to make sure, please don't hesitate if you do have any. And thank you, Pamela, for the rest of these. I will do a double check. And also with that flyer, I'll be sending out to Mark. And I will also, if you would like, I would be sending out a type of caption or paragraph that if you do want to share out to your individuals and your students, then we can do that just so they can understand that, hey, this is the link that you can use. This is what it's used for. The Student Talent Network would most likely be best for these individuals who are completely getting into the healthcare industry for the first time. If you go over or you direct any type of graduate programs that have, let's say, individuals who've been in the healthcare industry for quite a while, we may have to send you a different type of talent network link that's going to be utilized for our experienced individuals. And so I just want to make sure we have that. And so if you are one of those individuals that say, okay, I have my clinical nurse executive or my nurse executive leaders program, and they're all nurses, then we can move that forward to the nursing experience talent network. So they can still be in there, they can still be actively utilized, upload their resume and show their intention of what they're looking for, but they wouldn't be in the student one.
I had a kind of have to agree with Daisy and Mark there. That slide with those programs matching with the careers was a game changer. So would you mind following up if we can have those 2 slides, if you don't mind sending it to Mark, so it's easier for us as career advisors to match our students. So that'd be great. And one follow-up question. Go ahead, sorry.
Oh, no, I was just saying, of course I will.
Thank you. And then the final question for me is, for your remote work, do you still need to have meet their vaccine requirement?
That is a great question. I do not know currently, only because I know they just updated it. So what I can do is let you know. Remote. Perfect. Yeah. So I will definitely get back to you with that because I know they just updated their listing. So I want to make sure if that's for all associates, if that is for just in person, or what's that kind of field line. But I can get back to Mark and or you all and have that initiated. That's a great question.
While
then
we're,
Mhm.
oh, go ahead.
Oh, no, I was just gonna say, I'll make sure to put all of these slides and be able to send that over as well, especially, you know, highlighting the slides with the programs and being able to kind of indicate that these are gonna be specific roles that were taken out on, you know, Tuesday, October 8th or something of the sort. So just so they know and they are trying to look up these roles, let's say in Connecticut, we have to say, okay, well, we don't have a facility in Connecticut, but at least you know, and honestly, for these individuals, they know what type of roles that are going to be out there for their future job searching.
Hi, Alexis. I had a quick question for you. I also want to say thank you so much for mapping out the jobs in our program. So it was super helpful. And I know you spoke a lot about nursing internships, and also I looked on your website and I saw some of those posted as well. I was just curious if you know whether, and I know this may not be what you deal with directly, but if you know whether you ever offer internships related to health information management or public health. Our health information management bachelor's level students and our graduate masters in public health students are required to do practicums or practical experiences as part of their program. So I was just curious if you know if those are ever offered and if it's best to just look on your website, or if there's nothing there, if there's a good contact of someone to reach out to, like a recruiter that deals with like internships, or kind of if we have a student specifically interested in interning with you. Oh, I think you're muted.
Whoops. So for public health, and you said HIM?
Yes. Yep.
Could you do me a favor? I'm putting, and this is for everyone as well, if you have any additional questions that we may not get to, but if you can email me your requirements for those two for the internships, I want to check it and match to see what we may have. And if we don't have anything that I can find, then making sure I go over to my higher upper to say, hey, just to make sure if what would possibly be an option. Because I know sometimes, at least in the past, for other employments or things of that sort, they may have like, hey, this is a job or a temporary job, but you can utilize those hours for this as an internship or however the case is. I don't know, and I don't want to speak on if Ascension has that, but I will definitely find out for you. But just if you can email me that portion. And I also, just in case for right now, this is the School Contacts Connect portal. It takes a few seconds. All you would have to do, this is for yourself to put in your information and your area, your school, what your career advisor or you're an instructor or things of that sort. And so what happens is I'm going to be able to send you either monthly newsletters about what's going on in our area or just kind of what's happening within Ascension, or for our individuals to email you all on events or things that are happening within that area. And so for you all, we'll probably put you in a national, since we're all over. And so making sure, please just indicate that I would say that specialty that you look over. And so if it's internships for healthcare professionals or for public health or whichever, I'd make sure perhaps putting that in the title just in case. And so that would really help out, just so you're not getting any, let's say you're in a graduate program, you're not going to get any type of undergrad type of roles being sent out to you. So just want to help each other out with that. And then, like I mentioned, afterwards, I'll be sending Mark that flyer with a little snippet of what you can say to students for the Student Talent Network, and then including that link for them.
Thank you.
Perfect. And then I see Chelsea, she asks, what tips or suggestions do you have for non-nursing students who are new to healthcare when applying? That is a great question. For myself, depending on what field, but overall, if you're graduating, let's say in May, I would start looking March, April, and then applying mid-April or March. It does depend. If it's allied health roles, then you could start applying February, March timeframe. But if it's non-allied health or non-nursing, it's just healthcare students, for instance, getting into healthcare administration and they kind of need to get into their specialty first, then you most likely can do April time or a month before their graduation date. And just to make sure that they're putting on their resume that their expected graduation date is in May 2023, or which depending on whenever the graduation date is, just because that recruiter will be able to know and say, oh, okay, by the time we hire them, recruit them, I know to put their start date is most likely going to be after they get their bachelor's degree. So their start date might be June 1st or May 28th or whichever the case.
Thank you.
Oh, wonderful. And then for Jennifer, any special requirements for nurses to get into their travel program? Yes, we do, but I will look at and talk with our strategy partner to make sure that seeing if there's any specific requirements or if it's just, hey, you need to have your nursing license by the time you apply. Because I know sometimes you may need to have X amount of experience or whichever the case. I don't know if Ascension has that, but I will definitely find out for you. Is there anything specific? This is just for current nursing, or is this for registered nurses who just kind of want to have that job while they're going to school for something else? Or what would be the SNHU individual?
So all of our students that come in already have their RN license. So most of them have experience already working in the field. So every now and then we'll get students who want to be a travel, RN. So I was thinking like special requirements, like do they have to be with the company for like a year or so to have that privilege, or do they need to have like a compact license to travel to multiple states? Like that's what I was thinking.
Perfect. And I can definitely get that out for you as well. And check, because I know we do have a robust travel program. And so I'll just check with that strategic talent attraction partner who really specializes in that area, just to make sure I got all my X's and O's in order, and then I'll be able to get back to you.
I feel so bad we're putting so much on your list.
This is not bad at all. I trust
me. Thank you for that.
Of course. Are there any other questions I could try to assist with? You are all my first one to do presentations for, so I was very nervous, but everyone was so welcoming and kind. To give you some background, I've been with Ascension for over a year and I've dabbled in the university space, but in July, I officially was able to move forward to this position that I have currently. And so again, when we met in August, I was sending out trying different ways to engage. And so I sent out introductory emails and invitations to meet and talk through their school, what we have, and seeing where we can meet in the middle. And Mark was wonderful to establish a informational session. And I was super nervous, but I was like, okay, I will try this and see what will be beneficial for you all. And so I really appreciate all of the feedback. And if you have any feedback on ways that something you would have liked to have seen, I would truly appreciate it. Feedback keeps me on track. And so anything that is else that I could add that would be beneficial on your end, please let me know.
I will, I'd be happy to pass those along if anybody has any thoughts or ideas or suggestions, whatever that you would like to share with Alexis. But I'll just say again that you did what a lot of people don't do, and that's really listen and tailor it to our population and our program. So that was a great move on your part. So thank you.
Thank you. Wanting to make sure, because I know we still have 15 minutes left, but let me know if I need to hop off or anything of that sort, or if there's any other questions I can help answer.
I have one question. I mean, we don't need to stay a full hour. Sometimes we use an hour, sometimes we use 45. Occasionally we have to limit these to a half hour. I'm glad we didn't have to do that today. But I had written down when we talked, Alexis, in August, these 4 terms, and I think they represent areas of the organization, maybe the way that you guys break out the types of positions or roles. But I have national, technologies, living, and medical. And so you shared those with me. Are those the main categories of roles and employment in the organization?
That's a good question. I would say no, that's more of the pillars of what we have when it comes to the different processes and roles that we have. So technology is going to be Ascension Technologies. They have their own wonderful recruitment team, their own process. And then we have the medical, Ascension Medical Group, physicians, practitioners, anything of that sort. I believe physician assistants, that's their career page. And then we have Ascension Living, the senior care, and then Ascension. So within Ascension, our roles really do range from anything that's going to be needed within the hospital. So the national portion comes in that we have a recruitment team or HR team or whichever that focuses on that specific location. So Alabama, Texas, Tennessee, and then we have the national teams that focus on all of our states. So that's where I come in. And so the national team has national promotions, national marketing, national human resources, national strategy, various other nationals. And so I go into the strategy portion. And then when I tell you, we're so large and very organized, I will say, when it comes to where it goes, but explaining it does take me. I'm like, alrighty, so we start here and then we go down here. And then over here is where I can help, but this is a different process. So within Ascension nationally, I do help out on the university level. I do have a stronger focus on, of course, our nursing and allied health positions. But like I mentioned, we do help with business roles if we have questions, helping out with practitioner roles, for instance, or research roles like public health, things like that. But it's not on my skill set to where I can be able to speak on it confidently. So that's why I always kind of say, let me ask real quick and let me double check to see what the process is. Because sometimes, of course, they're just like, hey, we need to apply, and then I can let that individual know. And sometimes if a student applies, I will go straight to that recruiter and be able to say, hey, this individual replied, could you review? But sometimes that's as far as I can go with that type of process, since I don't have access to their applications and things like that.
Sure. Thank you. Thank you. I was going to share with the group quickly that of course, our department knows this. Others may not know it as well, but we use a system called Handshake to manage our employer accounts and relationships, as well as our students create accounts right in there. And then, of course, real central to it all, our job postings. And I'm sure there's always postings in there for Ascension, but only a small fraction of what they have on their own site, because it is a manual process to put them in Handshake from an enterprise HR posting site. Right now, there's positions posted for medical assistant, RN, patient care technician. Past positions have included population health analyst, senior data engineer, RN manager, behavioral health technician, specialist for qualitative market and communications research, virtual patient monitor. Those are the ones that jumped out at me. So just to give you a taste or an idea of the kinds of things that are in Handshake that your students might be interested in. So I suppose we could do a last call for any questions and then maybe finish up a little bit before the half hour so that folks can do something before their next meeting. So does anybody have any final questions for Alexis? Looks like a couple people are typing. All set. Okay, I get, thank you so much. Thank you so much is what we're getting. So I guess we'll wrap it up. And Alexis, thank you so much. And I appreciate being able to share out those slides because you can tell there's a lot of interest in those. And hopefully we'll continue a conversation in the months ahead and get the word out to our students about Ascension. And you'll see some of them applying and hopefully getting hired for roles over there.
Thank you so much. I had to make sure I wasn't on